Hi. The arrival and function of neutrophils in acute inflammation involves several unique steps. Step 1 has to do with the margination of the neutrophils. Now, due to vasodilation in the postcapillary venules, blood flow slows down and leukocytes or the neutrophils which move in the central stream are marginated to the periphery of the vascular lumen. Step 2 involves the rolling of the neutrophils. Now, histamine mediates the release of P-selectins by the weibel-palady bodies of the endothelial cells. On the other hand, E-selectins are induced by interleukin-1 and tissue necrosis factor. These selectins are placed on the surface of the endothelium in order to serve as speed bumps. Now, on the surface of the leukocytes are structures called the Sialyl-Lewis X bodies. The selectins bind to the Sialyl-Lewis X bodies on the leukocytes. This interaction results in rolling of the leukocytes along the vessel wall. Now, step 3 has to do with adhesion. And over here, cellular adhesion molecules ICAM and VCAM, or I cellular adhesion molecules and the V cellular adhesion molecules, are upregulated on the endothelium by tissue necrosis factor and interleukin-1. On the other hand, integrins are upregulated on leukocytes by C5a and LTB4 or leukotriene B4. Interaction between the cellular adhesion molecules and the integrins subsequently results in the firm adhesion of the leukocytes to the vessel wall. In a situation where there is a defect of CD18 subunit of the integrins, this could lead to leukocyte adhesion deficiency or LAD. Now, this is an autosomal recessive condition, and the clinical manifestations include delayed separation of umbilical cord during childbirth and recurrent bacterial infection that lack pus formation. Also, there is increased circulating neutrophils, and this is due to the impaired adhesion of the marginating pool of leukocytes. Now, step 4 involves transmigration and chemotaxis. Now, the leukocytes might transmigrate or they go across the endothelium of the postcapillary venules and move toward the chemical attractants. Neutrophils are attracted by and move toward the chemical attractants, which include bacterial products, interleukin-8, C5a, and leukotriene B4. This movement is called chemotaxis. Now, step 5 involves phagocytosis. Now, phagocytosis is the consumption of pathogens or the necrotic tissue, and it is enhanced by opsonins. Now, these opsonins are immunoglobulin G or IgG and C3b or complement 3b. Once the leukocytes or the neutrophils identify the microbe with the aid of the opsonins, they extend their pseudopods and form a membrane around the microbe, which becomes internalized and forms a phagosome. This phagosome then fuses with the lysosome within the neutrophils in order to form the phagolysosome. An impaired phagolysosome formation is characteristic of Chidiac-Higashi syndrome. This phenomenon of impaired phagolysosome formation causes increased risk of pyogenic infections because the microbes are internalized or the phagosome is formed, but they are not able to be destroyed because the phagosome needs to bind to the lysosome in order for the enzyme contained within the lysosome to destroy the microbes within the phagosome. Now, this Impairment can also cause neutropenia due to the intramedullary death of the neutrophils. It can also cause peripheral neuropathy as well as albinism. Now, step 6 of the neutrophils movement involves the destruction of the phagocytosed material. So this is followed by the step 7, which involves resolution. Now, neutrophils undergo apoptosis and then disappear within 24 hours after start of the inflammatory process or the inflammatory stimulus. So this means that within the first 24 hours of the inflammation, neutrophils are the predominant leukocytes that takes action. So now we are going to move on to what happens after the 24 hours, and basically that is going to be predominated by the macrophages. So basically macrophages predominate after neutrophils and peak at 2 to 3 days after inflammation begins. So macrophages are derived from monocytes in the blood. The macrophages arrive in tissue via the same process that was used by the neutrophils 24 hours ago, and that is by margination, rolling, adhesion, and then subsequently transmigration into the interstitial space. So the macrophages then ingest the organisms via the phagocytosis and augmentation by opsonins, and then they destroy this phagocytosed material using enzymes in the case of lysosome, which is produced by lysosome. So basically this lysosome produces lysozyme, which is the enzyme used to destroy the phagocytosed material. This process of killing these organisms is not dependent on oxygen. It's mainly done by the enzymes produced in the secondary granules, and in this case we are talking about the lysosome producing lysozyme to destroy the microorganisms. Now macrophages further manage the next steps of inflammatory process. Now there are a few outcomes of the macrophage activity, and these include number 1, resolution and healing, and over here anti-inflammatory cytokines such as interleukin-10 and tissue growth factor F5 are produced by the macrophages. These cytokines mediate resolution and healing. The next outcome is the continued acute inflammation. So this is also a possibility, and then it is marked by the persistent pus formation, and interleukin-8 from macrophages further recruits additional neutrophils in order to continue the inflammatory process. Now the third outcome or the third possibility is the abscess formation. So in this case, the site of acute inflammation is surrounded by fibrosis. Macrophages mediate the fibrosis via the fibrogenic growth factors and cytokines. And the final outcome or the final possibility is the chronic inflammation, where the macrophages presents antigen to activate CD4 helper T cells, and which secrete cytokines to promote chronic inflammation. Thanks for watching. Please like this video and subscribe to this channel. More videos coming up. See you in the next one.